Hey friends, welcome to my channel, Life with Everyday Haley. If you're new to my channel, welcome. I'm so happy that you're here. You'll find out quickly that I am on a journey of infertility with my husband, and I am transparently sharing my journey on YouTube for education, understanding, and relatability with you all. And I know myself, I find a lot of joy in this community on YouTube and relating to women. So I hope this video brings you peace. I hope my channel brings you education, understanding. And if you are where I am, I pray that we are not in this season of life forever and eventually we do welcome our rainbow babies into the world. So quick backstory before I get into my experience with the Saline Sonogram Procedure as well as endometrial biopsy. So I am a 30-year-old woman that is having recurrent pregnancy loss. I've gotten pregnant twice in a very short amount of time, but miscarried both times. So we are just going through like what's going on. Is anything causing this? How do we move forward with trying again and hopefully leading to success? So I've been going through recurrent pregnancy loss testing. I've learned a lot about myself over the past few months, as well as my husband. And there are some steps we're taking to try to better our success in the future. And so through that testing, two things that my fertility clinic recommended me do is the saline sonogram and the endometrial biopsy. Now, I already had an HSG done last fall for a different purpose. You are welcome to view my channel for more information about that test, why I did it, how that went for me. So that test was done in October of 2023. It is now March of 2024. Just a little backstory, I had that done after my first loss, which was a chemical pregnancy, because I do have a history of a genetic disorder that causes some people to have infertility, women to have issues with their fallopian tubes. For me, we feel like that is not the case because, or that is not affecting my fertility because I am able to conceive and carry an intrauterine pregnancy. However, they wanted to just look at my tubes to see if they were clear, if the dye flowed through them. So I encourage you to go look at my channel for the HSG version of these tests. Again, your results are pretty immediate, and I got a really good report that my tubes are open, dye flowed easily through it, and all was good. And again, that was in between my first and second loss. My second loss was a missed miscarriage. I went in at my 8.5-week ultrasound, our first pregnancy ultrasound, thinking everything was fine. And unfortunately, the baby had passed away. There was no heartbeat, stopped developing. So again, we don't know why. And so after that happened, I really felt compelled to start doing some additional testing and diving into, okay, what's going on. And so feel free to also view that video on my channel of that experience and how that was, what we had to go through, and moving forward. So they also would recommend an HSG usually in this setting. However, I've already had that done and it was fairly recently, so I didn't have to repeat that. So let's now get into how the saline sonogram and endometrial biopsy went. So I actually had this done today, this morning. So I wanted to grasp my raw feelings, because what I felt like is with a lot of these tests, the more time goes by, you kind of forget what it felt like. I feel like that's true for anything in life. So first of all, the reason these were suggested, the HSG is great about seeing if your tubes are open. The saline sonogram is different. It's where they inject saline and they're able to see on ultrasound, like a transvaginal ultrasound, how everything looks, see if there's any fibroids, polyps, or scar tissue or anything that looks weird. They can also take a really good look at your tubes. So it's a really good diagnostic test for women that are having recurrent loss or potentially like recurrent implantation failure and things like that. And so I knew when my physician, my fertility doctor brought it up, I was like, yes, we're gonna do that. The cost is a little expensive. However, with my insurance, it really was not bad whatsoever. So I've been very blessed with my testing through choosing the right provider through my insurance. I've had no problems with like how much it cost. So I just wanted to throw that in there. Make sure you look into that because these tests can be expensive. So they decided to do a saline sonogram and an endometrial biopsy on me at the same time. After a little bit of research before the procedure, I learned that that's a lot to do at once. So I knew that going into today that, wow, you're doing a lot at once, and some people actually wouldn't necessarily be able to do those back to back. I do think it's a common practice to do them back to back. And there's reasons why. So I'm under the impression that if they had seen something weird on the saline sonogram, then they may have tried to get a sample of it for the biopsy to, send it off. Luckily for me, I had a really good test. So I'll just walk you through the preparation, how it went, and after the fact. Anytime I'm experiencing a new test, I go on YouTube, like this video, and look it up. And I'm sure you are as well. So if you're watching this wondering how in the world your experience is going to be, I'm going to give you a very transparent video here. And I just want you to know that your fear and your anxiety is valid. I was literally so worked up. I could barely sleep. The night before, I almost just canceled it multiple times. The whole way there, I was like, I don't think I can do this. I was so terrified because if you look it up on Reddit or if you look it up on YouTube, you hear women say things like, it's more painful than childbirth. It's the most painful thing I've ever experienced. Fainted, I passed out, I threw up, I screamed, I cussed the doctor. I mean, you hear all kinds of things. And it really terrified me to my core, like thinking, what am I doing to myself? My doctor did tell me that it was going to be very uncomfortable and that she had it done herself. So I appreciated her transparency. She said that it's very quick. So that comes into the factor of the situation as well. And she said, but just wanted to let you know it's uncomfortable. And you should bring your husband with you. She also offered me a Valium prescription for the procedure, for the biopsy procedure, because I do have anxiety. Typically, I am really good at going into tests and different things with confidence, but after my losses and after like the headspace I've been in with recurrent loss and all this testing, the thought of additional physical pain is just unbearable for me right now. Like, when I'm in emotionally good headspace, I can usually power through something, but I've been really down lately. I'm not gonna lie to you guys, especially after my last loss and how painful that was physically and emotionally. And so the thought of more pain just really turns me off right now, to be very honest. And so I talked to my doctor. I told her, I said, I've been through a lot, and I think I teared up. And I was like, I'm scared about this. Like, I don't want to go through any more pain right now. And she was like, I'm going to give you a Valium prescription. You can take it when you get here, and then it will calm you down. And I'm really glad that I had that because it really ended up making for a really good day for me. That was the prep. I was told to take 800 milligrams of ibuprofen before this procedure, before these back-to-back procedures. So again, I looked up a lot of stuff online, was very nervous, was very worried about, is this going to be the most painful thing I've ever experienced? Am I going to be able to do this? And I will say that I have successfully come through it. Barely. I feel like I barely got through this. And so let me just walk you through all the nitty-gritty details now. It has been about 8 hours since my procedure, my 2 procedures, and I walked in this morning. After taking the ibuprofen, when I got there, they walked me into a very big imaging room with all kinds of equipment, which fertility clinics would have, obviously. They made me take a pregnancy test just to make sure I was not pregnant, because obviously this procedure would not be good if you were pregnant. And of course that was negative. As we have not been trying, we've been going through our testing process since my last loss. And then they were like, sign the consent form, which basically just was like, you know, there's a risk of bleeding, there's a risk of infection. Same thing with the HSG. I signed the consent form, so they then allowed me to take the Valium. They let me wait about 20 minutes, and then they came back in. And I will say the Valium hadn't really kicked in yet, but at the same time, I don't know if it really would have mattered anyway, with the amount of pain that I was in and the amount of stress that I was in. They told me to lay down, put my feet in the stirrups, and lay back. And I had obviously taken my clothes off. The waiting period between taking the medicine and waiting for them to come in was like an eternity. And I was like, can we please just get out of here or get this over with? Like, and so they came in, and it was a whole team. It was the doctor doing the procedure, and then 2 other nurses. And then there was also like a resident doctor. I think that was like training potentially. And then my husband was sitting right beside me, right by my head. So he was like, I got you. I'm right here. He was holding my hand the whole time. And I had been open with him about how scared I was because of how painful the HSG procedure was back in October. Going into the HSG, I didn't know what I was in for, so I think it was more shocking. And then today I kind of knew like that level of pain, and so I was like, like it was more scary to go into it, but I kind of knew. So I will say that kind of helped me. So I laid down, and then they inserted the speculum, which just opens up your vaginal canal. And they take a catheter with a balloon on the end of it and insert it through your cervix. This part during the HSG was easy for me. Like it just went right in. The resident, I believe it was a resident, was trying to do it and was having a hard time. So she tried a few times. It wasn't real painful though. Like I wasn't in a ton of pain when she was trying to do that. And they did warn me, like this can be one of the most painful parts of the procedure, is just the feeding through the cervix. They eventually got it. I don't know which physician did it, if it was the resident or the doctor. I wasn't looking. But eventually it went through, and I did feel like intense pressure pain. They're like, you'll feel some cramping. Honestly, some people think that's the worst pain. For me, it's not the worst part. It is probably the second worst part, but it's quick. And then once they get that catheter in there, for me, I don't have a ton of, it's like very mild cramping. And then they inflate the balloon, which kind of expands that canal. So that balloon was inflated for a good 15 minutes, I would say. That part can be crampy because you've got the speculum in, you've got the catheter in, and you've got the balloon inserted for a long period of time. In the HSG, to compare that, the catheter and balloon were only inside for maybe 2 minutes. I just remember that it was more painful during the HSG procedure. Now, my body may have learned to recognize that pain because I've had that procedure done first, potentially. And since I've had the HSG, I have had a significant amount of physical trauma with my loss. And so honestly, transparently, I feel like my pain tolerance is higher now because of my miscarriage and then having to take misoprostol. I went through like extensive labor type cramping with the contractions of that loss. And so I just feel like my body kind of has changed a little bit after that pregnancy. So the balloon was inflated with the catheter inside of me. And then they're like, all right, we are ready to inject the saline. So saline is a water-based solution to where when you insert it into the uterine cavity, it goes from like this to this. So it really inflates and they can see more detail inside of what's going on. And so with the HSG, the dye does the same thing, but they're not really doing it to look inside the uterine cavity as much as it flowing through, just to make sure it all flows. And they push it kind of fast with a lot of pressure so that it kind of flushes out your tubes. And HSG is a diagnostic procedure that is great for women that maybe are having a hard time conceiving, to kind of diagnose if you have a blockage in a tube, or to kind of help flush you, and it can help increase fertility. So back to the saline sonogram. So I was laying there. And they're like, we're ready to insert the saline. And I'll just say, I did ask the doctor to walk me through each step of the process. That was not really done for the HSG. And I just remember feeling a lot of surprise and shock to the pain. And so I was like, during my HSG, I didn't really know what to expect. Kind of took me off guard with the pain. In this procedure, do you mind just kind of walking me through what you do? And she did, and I really respect that. So she's like, okay, we're about to inject the saline. And guys, I knew this was going to be the part that hurt the worst, and it did. So as soon as they started injecting it, my uterus expands, major cramping, like a major cramp, same as HSG, maybe a little bit not so intense as the HSG. Because I think with the HSG, they inject a lot really quickly and then it just goes out. With this one, they injected the saline one time and I felt a giant cramp. And I believe like right before they injected it, they did take the speculum out, which is the metal part that opens up your canal. So I believe at this point that was gone. But they still had the catheter inside, so they could still keep injecting saline. So at least the speculum was gone, and I could feel a little bit of relief because that speculum is not pleasant, to be up in your vagina. So they injected saline, and she's like, okay, I'm going to put in the transvaginal ultrasound wand to look around. So she put that back in. No worries. At this point, that was the least of my concerns, right? And so she took a few pictures. Was very uncomfortable. I'm not going to lie. The big giant cramp kind of subsided after the initial injection. And so I was in moderate pain, but uncomfortable, but okay. So she's looking around and she's like, I need some more saline. So she injected again. And so I was like, ooh, they're like, brace for it. My husband was like, Haley, take deep breaths. It's another one. And so the second time hurt, but it wasn't as bad of a cramp as the initial injection. And again, same process. You just kind of have to let the cramps go. And then she took more pictures. She did it a third time, injected more saline, and same process. So after a couple times, I kind of knew what to expect. Did it make it better? No. Did it make it less painful? Of course not. But I kind of got the groove of what was going on. So she took several pictures. And I don't know why she did 3 salines. I don't know if that's typical or if she just was having a hard time seeing certain areas. But overall, it took about 15 minutes. And then the pain really wasn't terrible. As she's taking the pictures, the pain kind of was going down. Really, the injection is the real pain for me. And so at the end of it, she said, okay, like I've got enough pictures. Everything looks great. I don't see any fibroids. I don't see any polyps. I don't see any like scar tissue. She's like, your tubes look good. And so I got a really good report. So it was definitely the kind of report that I would want. So after she said all of that, she took out the catheter, took out the balloon, and I could breathe. Now I will say my husband was like, it's over, like breathe. Take deep breaths, like you're out of pain now. And I'm like, he doesn't get it because I was like, I'm not out of pain. Like, because I was still breathing really heavily, like Lamaze breathing. And he's like, why are you still so anxious? Like it's over. And I was like, I don't think you get it. I'm like, I'm still in a lot of pain. Like just because the procedure's over doesn't mean that I'm not in pain anymore. Like my uterus was still like, ah. So just know that like, even though the procedure's over and like the immediate pain is over, you're still going to be really crampy. Same for the HSG. I was so crampy after the HSG as well. And saline was like dripping everywhere. I did feel that throughout the procedure as well. I didn't mention that, but who cares? When you're on the table like that, I feel like when you're on the table in pain or giving birth, you just lose like embarrassment. Like that's just not a thing anymore. And you're just like in so much pain, you're just trying to survive. So that was the first procedure. So results were great to get those results. If they had seen a polyp or a fibroid or something of that nature, I may have had to have additional procedures done, like a hysteroscopy or something, to look and see what's going on. Again, this is a very common procedure done for women that have had recurrent pregnancy loss, just to make sure that there's nothing causing like issues in the uterus. And it can cause issues. And so, again, so rating that procedure, if that was all that I had done today, I think it would not have been as bad. The second procedure was really bad too. But I definitely think the saline sonogram was worse for me than the HSG, because the HSG, again, was a minute of intense pain and it just over pretty much. This one was 10 to 15 minutes, and it was injected several times. So, yes, I think they're both painful, but I think the saline one was worse. And I think that's weird because most people think that it's the other way around, that the HSG is worse than the saline one. So I guess it just depends on your body, how your body reacts. Could I do it again? Yes. Do I want to do it again? No. But after doing both of those, I'm kind of used to it now. I'm kind of like, okay, that's what to expect. It's not going to be painful forever. And here I am 8 hours later and I'm talking to you and I'm fine. Okay, so once the first procedure was over, they're like, all right, we're going to move on to the second procedure. And I was like, definitely not ready for this. Like, I'm still over here, like, trying to catch my composure. You know, remember, the entire time that the saline sonogram is going on, I am squeezing my husband's hand. I am crying and like trying to breathe heavy, like the entire time. And again, I reacted a lot more emotionally this time than I did at the HSG, but it was different. And like I told you in the beginning, my mindset has been kind of down lately. I've been struggling with a lot, and I've had a lot of physical pain lately with my loss. And so my headspace wasn't great going into this, and I knew that. So just remember, like, if you can, it's so hard to be in a good headspace after loss, but like, these procedures are hard enough even when you're in a great headspace. And then when you put on like grief and like anxiety and like all the things, it can be a lot. So don't feel embarrassed for crying, because I definitely cried. And I'll say this, the entire staff was so kind to me, supportive, listened to me. The doctor kept saying, you're in control. She kept saying that over and over, you're in control. Like, let me know if it's too much. And so she would inject the saline and she would say, like, let me know if it's too much. And I handled it. That's one thing about me, is I never tell the doctors to stop in these procedures. I keep going. I find a way to get through it because I know that it needs to be done. And so I'm just proud of myself for like not saying stop. However, if you get in there and it is too much, because I truly believe it would be too much for a lot of women. Like, I literally believe that somebody that has a low pain tolerance, or like high anxiety, like high anxiety, or has like a history of like sexual trauma, I believe that these procedures would be really difficult. Like, so advocate for yourself. And if you feel like you can't handle it, not under sedation, please try to talk to your doctor about at least getting pain medication, or Ativan or Valium or something like that that can help you. And I personally, just like taking a second to express my feelings, I can't believe that a lot of these procedures are done on women when they're awake, because I've had my wisdom teeth taken out, and I've also had extensive dental surgery while I was awake. And like, I've had teeth removed while I was awake, which was also terrible, but there's nothing that compares to this kind of stuff. Anyways, that's just my 2 cents. Okay, next procedure. So I laid there for about a minute, and my husband was like, take deep breaths in this time, in between. Honestly, no amount of time would have been enough for me to recover. I mean, I'm really glad that we just did it back to back, because I'm pretty sure if I had taken like 10 minutes, I would have been like, nah, I'm out of here. So I laid there for a minute, and they're like, you just tell us when you're ready. And I was like, let's just go ahead and do it. So they put the speculum back in and open up the canal there, the vaginal canal. And this part, again, is the endometrial biopsy. And I just want you to know that it is as bad as what people say. Okay, I'm just gonna walk you through it and then I'll give you my opinion. Okay, so she takes this long pipelle thing, kind of similar to the catheter for an HSG or a saline sonogram. It's about the size of a spaghetti noodle. They always say that, but it is accurate. It has a little suction on the end of it, so somehow, I don't really understand it, they can pull it back and then they take it inside, they insert it into your uterus, try to get to the top of your uterus, and then scrape down. And it collects a biopsy sample of tissue so they can send it off to do pathology on it. And in my situation, they want to make sure that I don't have endometritis, which is inflammation, infection that can cause recurrent pregnancy loss. Do I think I have that? No, but it was part of the workup and it was important and something easy that you can roll out. And so I said yes, and it's relatively inexpensive. I mean, the entire procedure can be a little pricey, but again, if you have insurance, I think they cover a lot of these types of things usually, at least mine does. And I just felt like it was worth it because if I do have that infection, I could continue to have pregnancy loss for a very common, easy way to fix it. And I believe it's just a round of antibiotics for myself and maybe my spouse. So it's like, well, why not roll that out? So before we move forward with like additional trying, we wanted to roll that out. And another reason why I did it is because a lot of my recurrent loss testing has come back really good. Also, my karyotype testing came back good, so I don't have a chromosome problem. And like the only thing that's come up in my blood work that is remotely suspicious is related to PCOS. And so that's kind of the route we're going down, but like I wanted to do this as well. You know, the doctor inserted the pipette and through the cervix, and that to me was more painful than the catheter. I just remember being like, oh, but then again, my cervix at this time had been poked and prodded several times throughout this procedure. One thing I did not comment on was that some physicians will numb your cervix. I did not have that. They did clean off my cervix for these procedures, but it did not get numbed. I definitely think numbing would be wonderful. I don't know why that's not offered where I was, but a lot of women say that helps a lot. She didn't tell me like, okay, I'm scraping or okay, count to 10 or anything like that. She just started doing the scraping. And what it felt like to me was like deep pinching. Like I'm trying to like describe it to you. I kind of blacked out at this point. Like this was the pain that maxed out any other pain I've ever felt. So I can't even hardly remember how it felt. And I did it today. Like, I think my brain just blacked out the pain. Is that even possible? You always hear that when you go through trauma that you just like black out the pain. Maybe I was in shock. I don't know, but I literally can't even describe the pain to you. It just felt like deep scraping that caused intense like cramping. It's almost like with each scrape, it was just like a cramp, consistent cramp. And so I just remember feeling like she went all the way up to the top of my uterus. I just felt like scrapes almost like all the way around the uterus. And she kept doing it. And I just, at first I started, making like moaning noises. Like, oh my gosh. And then I remember I was like really starting to panic. I think we were about 10 seconds into it. And I was like, I don't think I can do this. I don't think I can do this. I said it like 4 times. I don't think I can do this. I don't think I can do this. Um, and the nurse came around. Shout out to this nurse. She got me through this procedure because, again, it's quick, but it is a level of pain like you've never felt. And I don't know how I got through it. Like, looking back, I don't know how I got through that pain. Like, I'm surprised I didn't pass out, honestly. Um, the nurse came around and she was like, "You've got this. It's almost over. Haley, you've got this. You've got this. It's almost over." So she was trying to distract me. And I really appreciate her doing that because her just being there took my focus off of what was going on and like made me think about her. And it got me through it. And so I guess that's a tactic they use. Kudos to that nurse because without her doing that, I mean, I never said stop. So the physician did not stop, which I respect. And the physician is obviously intelligent enough to know, like, this is only going to last a few more seconds. Let me just get her through this. I will say this is kind of similar, and I haven't ever given birth yet, so I don't know what it's like to give birth. But I feel like it's kind of similar to probably that deep labor contraction right before you give birth, and when you're saying things like I can't do it anymore, it kind of was that level of pain. So just know, even right afterwards, I told her, the doctor, I was like, this actually didn't hurt as bad as I thought it was gonna hurt. Meaning I thought the scraping was gonna be more painful. The scraping part didn't really hurt. It was like every time she scraped, it was like a deep cramp. So the cramping, it was like my uterus was like responding to the scrape. That was the part that hurt worse than the actual scrape. Does that make sense? And it was like a deep internal scrape. So even just thinking about it, holy crap, that was really painful. So what you see online about it being very painful, very, very painful. Is it quick? 100%. It was so quick. And I think even after going through that long saline sonogram that took so long, it was so drawn out, it was painful, then doing this was like, oh, well, that was really quick and like not really that big of a deal. So just having that be quick after that, I was like, you know what, actually, I'd rather do a biopsy, I think, than a saline sonogram because it's so quick. So, I mean, you got to weigh your pros and cons, right? And if I had to just go into the office and do a biopsy, I think I would definitely be able to do it again just because it was so incredibly quick. It could not have lasted longer than a minute. But it was the kind of pain that I hope I don't ever have to do that again. I really hope I don't have to do that again. So just know that like I didn't pass out. I did not throw up. I did not cuss. I did scream a little bit and like moan a little bit and say, I don't think I can do this. But that was just me trying to like tell the doctor like in that moment, like maybe I need a minute. But the way that it works, she just has to kind of scrape for a few seconds and then it's over. So she just kept going. I mean, by the time she stopped, it would have been over anyway. So honestly, by the time you start feeling like I can't do this, you maybe have 10 seconds left in the procedure. So was it the worst thing ever that I've ever experienced while being awake? Yes. Did I feel like I was dying? No, I don't think I felt like I was dying. I see a lot of comments, people saying like I felt like I was dying. I didn't feel like I was dying. I just felt like I was in intense pain and just wanted it to be over. But again, it's a very quick procedure. It tells you a lot of information about what's going on. And if you have to have it done, it is going to hurt. There's no if, and, or but about it. You are going to have like a uterine reaction of cramping. You are going to feel probably faint and dizzy like I did afterwards. You're gonna cry. but it is not going to kill you. Let me just say that it's not going to kill you and you're going to survive it. That's kind of how I would describe it. And then as soon as she's done scraping, the really intense pain stops. Okay, so she got done scraping. She pulled out the pipelle, pulled out the speculum, and she's like, okay, we're done. And then the doctor exited the room and the nurse was still there. So I laid there. Actually, I think this is when the doctor was still there. I started sobbing. Like as soon as it was over, I think the emotional buildup from everything and just like me trying to be still for that long, for like a 20-minute procedure like that, the 2 procedures, just the emotional, like, oh, I can breathe now. Like, oh, this is over. I just started sobbing. Like, and I know, and y'all, I am an emotional wreck right now because I've been gone through so much. So that adds on to it. But I just laid there and cried. And I didn't care what anybody thought of me. I just cried. And my husband was like, it's okay, it's over. And I was just crying because I was like, that was a lot, you know, just a lot of emotions, a lot of pain. And like, it's very hard to lay there for that long and like just be still through that pain because you can't move, you can't get in a fetal position. You're just laying there while they're doing all this stuff to you. And it's like hard to just lay still in the midst of pain, you know? So I finally was like, oh, I can breathe. So I laid there for a minute and I was just feeling, afterwards, I was feeling like a lot of cramping, and just did not feel like getting up. I just did not want to sit up. I was like, I don't feel like I can sit up right now. So the nurse was like, just lay down. They turned the lights off, let me rest. They're like, just rest. We'll be back in a minute. So they came back in just a minute and I was like, I'm okay. And they were like, do you want some juice? Do you want some crackers? And I was like, absolutely. So they brought me juice, they brought me crackers, and I'll show you with my drink. I had the juice in my hand and I was shaking so much that the juice was going like this. And my husband was like, you are going to drop your juice. He was like, why are you shaking so much? And I was like, because that was so painful that my body was like having a reaction to all of that pain. Like I was sitting there like, you know, and he's like, calm down, it's over. And after a minute or two, I did stop shaking. So I ate the crackers, drank the juice, and she's like, are you okay? And I was like, I'm okay. I said, I'm not feeling faint. I'm not feeling dizzy anymore. I'm okay. And just a heads up, many women do feel faint after procedures like this, or get dizzy. Something about your cervix and all the cramping and the fluid, it can just make you kind of feel very dizzy. And so sometimes they just say, you know, just lay down for a while. And I did, but not too long. I mean, honestly, within a minute or two, I was like, I'm okay. And I remember I got up and she also gave me a washcloth for my face. She was so kind. The nursing staff was so kind to me. I really appreciate the medical staff through this procedure. They made it so much easier for me to go through. And so I got up, put my clothes back on, and I was like, okay, I think I'm ready to get out of here. Like after all this, let's get out of here. So I exited and I told them thank you. I said, you know, that was a lot. I'm sorry I got so emotional and so freaked out. I said, but it was a lot, but I just said, thank you for your kindness and for like walking me through all the steps of the procedure. It really mattered to me and it really made me feel better through the whole thing. So thank you so much. And they're like, you're welcome, have a good day. So I just wanted to tell them that because I feel like their level of care was so helpful and compassionate that it got me through like a really hard day that I've been dreading and I was really, really anxious about. Okay, so after the fact, so I did have to put on a sanitary napkin. I immediately was bleeding afterwards. Also, I looked in the trash can and there was a ton of blood in there and a ton of liquid. And again, they scrape your endometrial lining, and so you have to heal from that. And so I was walking out of the office and I started feeling faint. Go figure. And I told my husband, I said, I think I may have gotten up too soon. Like, I may have gotten up too soon. And he's like, okay. And so we got on the elevator, and I swear there was more people on there with us. But I was like, I think I'm going to pass out. And I was like eating crackers in the elevator. And those poor people probably thought, what is wrong with this girl? So we got into the lobby, and he's like, do you want to sit down in a chair? And I was like, yes. So we sat down in a chair. I was like, I just need a minute. I feel very faint. Again, I was on Valium as well after going through that. So it could have been a mixture of a lot of things. And I had also been laying down for 30 minutes. So yeah. So we sat down for a minute, and then we realized the car was like right outside. So I was like, I think I can make it to the car. So I got up and walked to the car, and I was fine. Got in the car, got my blanket, turned on my seat warmer. I was like, okay, I'm good. But I did have just mild cramping after that. And I just remember we left and we went to get me something to eat, like bigger on my stomach. And I think that helped me a lot. So we went to Chick-fil-A, one of our favorite breakfast spots, and we got a nice breakfast. We did eat inside. I was a little sore, so walking was a little difficult for me, and just like sitting down, but I was fine. And then in the car on the way home after eating, I was like, I feel a lot better. I got some protein, some chicken in my body. And I laid my seat back, turned on my seat warmer, had my blanket, had my water. Always bring your water. Keep yourself hydrated. And I just kind of rested. And again, that Valium was in my system. And at this point, it was really kicking in. And so I just felt very tired and relaxed, and just took a nap pretty much. So we had about 30 minutes. So really it was more like 30 minutes on the way back home. And I took a sick day today from work. So I would definitely recommend taking a sick day if you do have to do this procedure, or both of these procedures. Once I got home, I literally immediately put my pajamas on and laid down, got my heating pad, and just rested. And cramping has been mild. I'd say 3-4 out of 10 today. Maybe kind of like what you feel with your period. I don't know. It's not the worst period cramps I've ever had, but it's not the best either. So I'd say probably pretty moderate period cramps. Luckily, ibuprofen does help. So when my ibuprofen was out, when the time was up for me to take more, I did take more ibuprofen. And I just rested all day. And then around 5, I was feeling better. I got dressed and was like, I'm going to go get myself some yummy food. So I went to Sonic, got out a little bit, and now I've just been kind of chilling. So again, it's been about 8 hours and I'm okay. I do have cramping. I'm bleeding more than I thought I would. So heads up, you definitely need to put on a pad. It really feels like a period again, but it's weird because it's not a period. And when I went to the restroom, this is kind of TMI, so trigger warning, little pieces of tissue kind of. So I guess there's just some stuff that's kind of coming out after they did their biopsy. And I was kind of like, ew, that's kind of gross. But again, I've been through a lot. I've been through pregnancy loss, so I've seen everything under the sun down there. So nothing surprises me at this point. It just reminds me of how difficult it is to be a woman and all the things that we have to go through with our menstruation and pregnancy and all things down there. So if you do have to have this procedure, a few final tips. Take ibuprofen prior. Ask for Valium or sedation if you don't think you can handle it. Have your husband go with you or a support partner to hold your hand. Ask them for juice and crackers afterwards if you feel kind of faint. That was very calming for me as I sat there. Bring a blanket in the car. Make sure you eat before your procedure so you don't feel faint or feel faint with the ibuprofen. And just know that it's quick. Saline sonogram, not so quick, but the endometrial biopsy is. Doing back-to-back is difficult. So if you don't feel like you can handle both at the same time, talk to your doctor about that. I did. I'm proud of myself for what I did. So next steps, saline sonogram results were pretty much immediate. Biopsy results are supposed to come back in 7 days. And again, if it does show signs of an infection, I will take antibiotics. So that was my very very transparent walkthrough of the saline sonogram that I had today, as well as the endometrial biopsy. Feel free to go watch my video about my HSG procedure, which was also very transparent. And I got through it. So if I can get through it with my anxiety and my fear and all of the pain that I've been through recently, you can get through it too. So just hang in there and advocate for yourself. So if you have any questions about the procedure, would like more information, or just want to connect with somebody that understands, feel free to subscribe, comment below, and we can talk about it. Thank you so much for following my channel. You can view my channel for all things fertility, my journey, my tests, my losses, everything under the sun for you. And thank you for following along. I will see y'all next time, and I hope you have a very blessed day. Thanks for watching.